Hi, I'm going to demonstrate the structures or features of the heart. This is the heart of the sheep. Looking at the external anatomy, the heart is covered with the visceral pericardium, also called the epicardium. This is the apex of the heart, and this is the base of the heart. I will turn this heart over so it will show the posterior view. So we can see the atria. This is where the atria, the right, or this is the left atrium and the right atrium. And on top of that, this is the auricle to the left and auricle to the right. The right atrium is the receiving chamber for deoxygenated blood from the different parts of the body, and the left atrium is the receiving chamber for oxygenated blood from the lungs. The right and left auricles serve to increase the size of the atria so they can hold more blood as is necessary when we exercise, for example. So now I am going to turn the heart, and I'll show you these parts here are the ventricles. The ventricles are the discharging chambers of the heart. The right ventricle discharges blood to the lungs, and the left ventricle discharges blood to the different parts of the body. This is the interventricular sulcus. The interventricular sulcus has the anterior interventricular artery and the great cardiac vein in the anterior side. And when I turn this to the posterior side, there is another ventricular sulcus which holds the posterior interventricular artery and the middle cardiac vein. This is the pulmonary trunk, or the vessel here. The pulmonary trunk is where the blood that goes through the lungs. This is the vessel that carries the blood to the lungs, and the blood that it carries is a deoxygenated blood. Turning back again to, okay, I will stay here in the posterior side. You will better find also the ascending aorta. The ascending aorta, which is not very clear in here. Ascending aorta has an aortic arc, and it has three major vessels: the brachiocephalic artery, the left common carotid, and the left subclavian. So, and this is somewhere here in this area. There is the superior vena cava and the inferior vena cava and the coronary sinus. So this is the superior, and below that is the inferior, and there is this coronary sinus. These vessels are veins, and the blood they carry are deoxygenated, and the blood goes to the right atrium. Let's look at the internal anatomy of the heart. In the internal anatomy, or in the internal area of the heart, or inside the heart, we will find the pectinate muscles, which is found in the atrium. in the right atrium. And we also find, these are the pectinate muscles here, and we also find internally the myocardium of the right and left ventricle. So this is the myocardium of the right ventricle, or of the right ventricle, and then the left ventricle. The myocardium of the left ventricle is 3 times thicker than that of the right ventricle because it pumps oxygenated blood to the rest of the body. The resistance in the systemic circuit, which is distribution of the blood throughout the body, is 5 times greater than that of the pulmonary circuit, which is pulmonary circuit is the passage of the blood to the lungs. And thus the wall of the left ventricle is thicker. Internally, the walls of the ventricles have ridges called the trabeculae ridges, or trabeculae carneae. So we also will find the interventricular septum. The interventricular septum is that wall, septum meaning wall, and then we also find the valves, the bicuspid valve, which is between, or the mitral valve, which is between the left atrium. It's the passage to the left atrium to the left ventricle, and the tricuspid valve found in the right atrium. In the just under the valve, there is the chordae tendineae, this fibrous feature, and we have the cusp of the valve in this area, which closes and opens for the passage and the blocking of the blood when it goes to the ventricles. Then we also find the papillary muscles. These papillary muscles are connected to the chordae tendineae. We also find the pulmonary semilunar valve and the aortic semilunar valve. So those valves are the openings. For the aortic semilunar valve, it is the opening of the aorta, and pulmonary semilunar valve is the opening of the pulmonary trunk. It's somewhere here. And this ends the presentation.